Screen behind her.
Okay, oh God, I hope the sound didn't go through.
No, that's just my dad. Did you mute? She can't even see you.
It's beautiful. So pretty.
I think that's his screen behind him. I don't think that's her house. That's not her house.
I don't know.
See,
I
that's her
think it
chair.
is.
See, that's
I think it is.
that's not her house. That's a green screen. Yeah.
You know, I haven't heard the sirens yet, so I'm wondering what's going on with that. I'm still admitting a few people here into the meeting. 1 second.
Maybe it's that we've all got our days screwed up.
That's the first thing I thought of was to be here. It is a new year, you know, it takes a little while to get back into the swing of things.
I'm not sure that they run it when it's weather, like since it's rainy today.
Yeah, maybe that's it.
Chuck, our Rotarian of the Year, Harmony Morrissey, works for the city, so I bet she would know the defense.
I'm looking for Bills if he's on here.
Throw me under the bus, Gary. Throw me under the bus.
Rotarian of the Year is under the bus? That's a compliment. The supreme compliment, as a matter of fact.
We got quite a few joining in here late, so. Well, we'll get started with or without the siren. Well, greetings and welcome to the Hot Springs National Park Rotary Club via Zoom on January 6, 2021. Wow, 2021. It's hard to imagine that we're already in 2021. I hope everybody had a wonderful holiday season, enjoyed time with your family and friends. And to start the new year, I've got frankly, a Christmas miracle to talk about and something that I think that we'll all enjoy. Everybody loves Christmas miracles. You know, I was home alone on the evening of December 10th, the night of our holiday paint party. And I was the only one in my house. My wife was out of town for the week. And I had a bottle of Chardonnay chilled in my wine cooler, and I had my laptop opened up, connected via Zoom, and I had my art kit laid out on the table with my brushes and my blank canvas and my paint and my bowl of water. And I was had a little bit of anxiety going on during that time. So, but as the time approached for the meeting, and we started the actual party, I really had a lot of anxiety, and I had very low expectations of my talent and low expectations of the pain that I was about to try to produce. And it was the first time I've painted something since elementary school, so you had to realize that it's exactly in my wheelhouse. And the portrait we were given to paint was intimidating to me. It was a snowy outside picture of a window pane that's draped in snow with a candle and evergreen branches that are around the candle and had snowflakes falling down. It was really intimidating to me to even try to imagine myself painting such a beautiful portrait. So the confidence and the anxiety grew, and the confidence even shrunk more then. It was quite the intimidation to me just to think of myself making that painting on that canvas that was blank at the time. So I actually wished I had to paint by numbers, but that wasn't in the case. That was in the cards. We had to paint like a real artist. So there we were. And I was lucky enough to have a great instructor and a great person, by the way, Mr. Anthony Tidwell. He began to walk us through each stroke of the painting, wearing his Bob Ross look-alike outfit, which was comforting to me. And I took my first stroke of the paintbrush, and sure enough, I made a mistake. You know, I didn't put the line where I needed to put the line. It was too low. So I started out of the gates with a stumble and thought, why am I doing this? Am I able to do this in that situation that I found myself in? But as time went on, because of Mr. Tidwell's talent, he slowly walked us through the process of learning how to be creative. And at the end of the session, which took over an hour, we were finished. And looking at my painting, I was proud of it. I couldn't believe that that was on my table. And I was kind of like a first grader who brings his first artwork home, you know, to his mom and begs her to put it on the refrigerator door. I was kind of excited about it. But then I thought, well, what do I do with it? So I ended up putting the picture up on a wall that's in a room in my house that's rarely ever occupied, our formal dining room. So that way nobody will see it. I'll be good to go. Well, my wife comes back home the next day and she calls me, and the first thing she asked me is, Chuck, where's the painting? I said, well, it's in the dining room. Why do you ask? She said, I want to look at it. So I said, okay. So she went to look at it, and my expectations were, well, this is going to go into the closet, you know, something like that. She said, it actually looks pretty good. Well, I was stunned. I mean, I was giddy and excited. I felt like I just won the top artist award for the Garland County for the year. I mean, that's where I was at that time. My wife liked the painting. And to go a step further, she even said, you know, we're going to put this in the den beside the Christmas tree. Well, that was just like giving me a gold medal in the Olympics. I mean, I couldn't believe that I produced something that was going to go in the den, you know, beside the Christmas tree. So as time went by through the holidays, we had guests come over and family come over, and they would all say, who painted that painting? And my face would turn red. My wife would say, well, Chuck did it. And the first thing they would say, every one of them, by the way, would say, really? He did that? So that's my Christmas miracle for 2020. It was a pleasure, and it was an absolute enjoyment for me. And by the way, here's the painting, if you want to see it. It's
All right.
it's it's got my name on it, and just for measure, on the back of it, I put Rotary Pandemic 2020. So I'll probably keep that paint on the wall the rest of my life. But I know that if I ever see it in a downtown gallery and Mary Zunich's looking at it, then I've made it all the way, right? So, you know, Bob Ross said, all you need to paint is a few tools, a little instruction, and a vision in your mind. And that's what we had the night of December 10th. So thank you so much to Harmony Morrissey, to Sissy Bennett, to all those in the fellowship committee that worked so hard to put that together. It was a great success. I thoroughly enjoyed it. It was our first virtual Hot Springs National Park Rotary Holiday Party. Probably will be our last. I'm sure next December we'll be enjoying Chef Brad's gourmet food somewhere together in person, but it was a great enjoyment. I really appreciate it very much for all those involved in putting that together. And today we'll get started with our invocation, pledge, and four-way test. And our invocation will be done by Mr. Bradley Hargis, and our pledge by Mr. Clay Farrar, and our four-way test by Dr. Stephanie Newhouse.
Well, Happy New Year, everyone. It's great to be with you today. I know that for many of you, you might know that today is All Kings Day or Epiphany. So in the spirit of service, let us pray over our meeting today. With our friends with us and no person beneath us, with the bonds of Rotary between us and our worries behind us, may our goals for the new year be before us and no task be beyond us. With a thirst for knowledge and a dream of a polio-free world, we are thankful for our Rotary, our friends, and our community, and the opportunities in this new year. Amen.
Amen.
Join me in the Pledge of Allegiance, and I'll leave to you whether or not you wish to stand or not. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, indivisible, with liberty and justice for all.
And join me in the Rotary four-way test of the things we think, say, or do. Is it the truth? Is it fair to all concerned? Will it build goodwill and better friendships? Will it be beneficial to all concerned?
Thank you so much. I appreciate it very much. And happy birthdays. It's the first meeting of the month. So January birthdays. Happy birthday to Tim Metcalf, Arthur Floyd, Bo Britton, Renee Bartholomew, Richard Payton, Dr. Gene Shelby, who's with us today, Joe Patrico, Sissy Bennett, Susan Aldrich, Jeremy Brown. Congratulations, Jeremy. Richard Harrington and Dr. Jack Porter. Thank you. Happy birthday to all those Rotarians that we care greatly about. Hope you have a great birthday this month. A few announcements to get started. I'd like to thank Romeo Lopez and the Hot Springs National Park After Hours Satellite Club for a great job in their Toys for Tots. That campaign went through the late middle part of December, and they collected over 1,200 toys that were given to over 1,000 different families. That's just a phenomenal job. They had so many toys, they had to get an extra truck just to haul it. So that was a great success, great way to end the year for that club. And I really appreciate everything they did, in addition to the 4 other projects that they also did throughout the year. I also wanted to thank Roxanne Butterfield and the Scholarship Committee, as well as Tiffany Rogers, who's the club director of that committee, for an excellent launch of the Scholarship application. It was in the newspaper, very well written. The word's out, the application's ready. And they just done a phenomenal job in getting that geared up and getting that moving this year. And that's one of our prize jewels in our club is our scholarship. So thank you to all of those who were part of that. And then also we do have a board meeting next Tuesday on January 12th. It'll be via Zoom, 11:45 a.m. If you want to join, please just reach out to me or Donna Kay, and we'll give you the link to that meeting. Please attend if you so want to. And now it's time for our economic minute by Hot Springs National Park Rotary past president and president CEO of Hot Springs Chamber of Commerce, Mr. Gary Troutman.
Thank you, President Chuck. As you can probably see behind me, I'm at Rotary International today in Evanston, Illinois. So I hope you guys can hear me okay. We're in the logo here, logo behind me. So I hope the audio is still good from several states away. Actually, I'm on Ouachita, but I just thought I'd spice it up just a little bit today. Thank you, Chuck. Our report this month, Shannon LeDuc, I think most of you know on our staff, we're very thrilled. She and I were asked to Little Rock to present to all the new state chamber employees across the state on growing membership, and especially during the pandemic, and just really proud of Shannon. She's added over 350 new members to our chamber in just a little over 2 years, including almost 170 last year amidst the challenges of the pandemic, as you mentioned, Chuck. We were able to have our Ice on Ice event greatly reimagined thanks to Betsy on our staff and Toddy Petard from Loray's at the Vault, Via Roma, and Back Porch Grill early in the month of December. It is certainly Laura Miller and National Park Services and the city's event, not ours, but just want to alert everyone that the National Park's 100th anniversary is coming up this year, and now it's just only about 3 months away. So I'm sure we'll be hearing a lot more about that soon. At the partnership here, we continue to advocate for the city and county on transparency of turnback money from the state, from DF&A, and the new legislative session. I know Senator Sample and Les are among our members, and Representative McGrew, the new representative. They start in Little Rock on Monday, so we're going to get a whole new session of that going, and promises to be an exciting year. City Manager Bill Burrow, County Judge Daryl Mahoney, and I continue our monthly luncheons as we did just right before Christmas. And maybe the highlight of my report today is you will remember we brought Quint Studer to town about 1.5 years ago. Hot Springs was recognized as one of 8 vibrant communities in the entire United States by Strong Towns and also by the Studer Community Institute. So, we just continue to get these national accolades that I think Steve Arison would back me up. You just can't pay for the kind of press and PR that Hot Springs continues to receive. And certainly on the partnership and Chamber's behalf, we're use it in every marketing possibility that we can. Because of Ice on Ice, we were able to make a check presentation to Project Hope Food Bank and the great work that they do there. Finishing up, I see that Clay and Jack and Mike are all on the call. Just want to continue to thank them for all the work on ACTI. You've probably seen it, probably saw the story Monday on vandalism to the building, but there's been a lot of movement there. Clay has continually used the VA as an example in Little Rock, but the VA actually sold a few weeks ago. So that gives us kind of renewed hope. It's still, everything's a long shot if we're being honest, but we're looking for things to get excited about. So someone new to try to reach out to there. We'll have our workforce guru, Rick Neal, back in Hot Springs. Hot Springs will be the pilot program for workforce in the state of Arkansas. That will be next Thursday. And very last thing is I want to welcome our new chairs for 2021, Bruce Jones, the VP of Gaming at Oaklawn, and you all please pray for me. Dr. John Hogan will be chair of our partnership from National Park College. So Chuck, that concludes my report. Appreciate the time as always. Thank you.
Thank you, Gary. Thank you very much. And now for introduction of our guest speaker, and we have Hot Springs National Park President-elect Tiffany Tucker, who I'd like to also say that's done an excellent job this year for the first 6 months. She's had a lot of challenges, and as well as her committee, and she's just done an excellent job as well as her committee members. So she'll be introducing our guest today. Tiffany.
Thank you for the kind word, Chuck, and Happy New Year to all of you. Today we have with us Dr. Jean Shelby, who has been a member of our club since 2004 and is a Paul Harris Fellow. Dr. Shelby served two terms as a Democratic state representative from Hot Springs, where he served as vice chairman of the House Committee on Public Health, Welfare, and Labor, and also the chairman of its Health Services Subcommittee. He was a member of the House Committee on State Agencies and Governmental Affairs and the Joint Committee on Public Retirement and Social Security Programs. Dr. Shelby was an emergency physician at National Park Medical Center and has practiced medicine in Hot Springs for over 30 years with a distinguished career. He served 3 terms as Garland County coroner before being elected to the Arkansas legislature. He currently works for MedExpress Urgent Care Centers and has served as the Garland County Health Officer since 2004, which is a volunteer position appointed by the county judge and approved by the director of the Arkansas Department of Health. During his career, Dr. Shelby has received numerous awards and recognitions, including the Champion for Children Award for the 2007 legislative session, the Public Health Hero for his work in the 2009 General Assembly, recognition from the Injury Prevention Section of Arkansas Children's Hospital, and Statesman of the Year by the Arkansas Hospital Association for his work on the trauma system legislation. In addition to his emergency medicine practice, he has been treating patients with HIV who reside in Southwest Arkansas for over 25 years. He has served as medical director for the hospice program of the Arkansas Department Hospice Program for 10 years. And over the past 10 years, he has also run a small clinic for people suffering from opiate addiction. Dr. Shelby served as the chairman of the Board of Trustees of the Arkansas Medical Society in 2012 through 2014. Dr. Shelby grew up in Little Rock and graduated from Central High School. He went on to receive his bachelor's degree in chemistry from Princeton University and returned to Little Rock to study medicine, receiving his MD from the University of Arkansas School of Medicine in 1977. He interned in Texas before serving as Peace Corps Medical Officer for Zaire and Rwanda. We're so proud to have Dr. Shelby here today to give us an update on what COVID looks like today in Garland County and around the state. So please give a warm Rotary welcome to Dr. Jean Shelby.
Thank you for that nice introduction. I've kind of went on a little bit further than I expected, but I appreciate the kind words. Yeah, the COVID is, such a big thing all across the world, and there's so many different aspects to it. But what I'd like to do over the next few minutes is just kind of summarize what we've done and how our response to the pandemic has been here in Garland County. Early the first week in March, actually, Bill Burrows and the county judge, Daryl Mahoney, and the fire chief, Ed Davis, got together and to set up a task force to respond to the pandemic that was approaching Garland County. And we had our initial meeting that first week in March. We had our first couple meetings, I think, were in person, but since then we meet every Monday morning by Zoom. And we've kind of expanded the members of the task force. Started out with we have representatives from both of the hospitals, representative from LifeNet. We have our chief of police and the Garland County Sheriff's Office, with kind of some of the original members, as well as Bo Robertson with the Office of Emergency Management. And so we over the months we have expanded it. As when school started, we brought on board the superintendents of the school districts in Garland County. When we also now have representatives from the nursing homes. We have Gary Troutman from the chamber and Steve Harrison from Visit Hot Springs. So we've got a really wide involvement of people that are in the county on different functions. And I feel like we've done a good job of really starting out early in addressing the pandemic. During the month of March, we were able to set up some testing sites, and we set up our own local call center, which I think has been very, very helpful in terms of getting direct answers locally rather than depending on a state system. Janice Ivers at Community College has really taken that on and really put a lot of effort into it, and kind of getting information out to people that called in. Initially, a lot of the questions were just general questions about the virus and also about how to be tested. Certainly now, a lot of the emphasis is on vaccines and just kind of general questions about continuing with the testing. At each one of these meetings on Monday morning, I give a report of where we stand and what in terms of how the virus is affecting us. And during the months of March, April, and really most of May, we really had the virus very well contained compared to a lot of the areas in Arkansas. And it's kind of looking back from now, it's kind of hard to imagine that in the end of May we only had like 4 positive cases per week. We had like 10 active cases, and as everyone knows, a lot's happened in the ensuing months. And what our pattern has been and continues to be, and I don't know that it's a lot different than other places around the state and the country, but at each of the holidays, pretty much any time we've had a 3-day weekend, we've had a spike in our number of cases, new cases, and our active cases, and that's really started with Memorial Day around the 1st of June, and in the month of June, we had a really significant jump within a couple of weeks. We went from 15 to 20 new cases, though, in the first part of June, to 50, up to even in July up to 90 new cases per during a week's period. We had our active cases go from about 5 to 10 up until and then in June and July they jumped initially up to about 40 cases, but by the bump that we received on the 4th of July weekend, is, you know, it really started doubling with in terms of our active and new positive cases. And then that's continued on. Labor Day weekend was not as dramatic, but we did see some increases. And then over the last couple months with I think, you know, Halloween, we saw during the week or two after Halloween, we saw really significant increases in our caseloads, up to getting up in the range of 200 new positives per week, with our active cases getting up in range of 250. And subsequent to that, we had, you know, Thanksgiving, and we saw again almost a doubling of our new cases and our active cases during the month of December. And unfortunately, you know, with the Christmas holiday and kind of a back-to-back with New Year's, we continue to see increase in cases, new cases and active cases. At my report this Monday, during the previous week, we had 554 new cases, which works out to 79 new cases per day. In our testing, at first, you know, our testing was pretty robust compared to a lot of areas in the state, and we continue to add to our testing and testing capabilities. But we've kind of leveled off that we're doing about 3,000 tests per week, and with the rising numbers of positives, our positivity rate has gone up significantly. We were back during the summer, you know, we were having pretty good testing, and our numbers weren't as high, so our positivity rate was around 5%. But since the 1st of November, it's kind of steadily increased. On the 1st of November, our positivity rate was 9.1%. Then in December, we got up as high as 16%. And right now, our positivity rate is 17.1%. So it's, you know, and unfortunately, with a pandemic like this, and with there's so many active cases, I foresee over the next month or two, possibly a doubling from what we have now. I could see us easily having over 1,000 active cases in the county within the month of January. You know, one of the good things that we're focusing on is the vaccine program. And when, you know, there are vaccines being given in Garland County, not great numbers at this point. It's still early in the program. There's still a lot of logistical challenges that fortunately we've got good people working on that, and to try to get the vaccine. But with the limited number of vaccines coming to the state and into the county, it's going to be several months before we have enough people vaccinated to make a real dent in what's going on. So at our meeting on this week, I really kind of re-emphasized that right now it's more dangerous in Garland County to catch the virus than it has been during the whole pandemic. And it's really spread throughout the county. We've seen spikes, in Hot Springs Village now that we hadn't seen before. Some of the early spikes we had and that were concentrated in some of the nursing homes. That seems to be, pretty well under control. They're doing, extensive testing, and they started last week doing some of the vaccination programs in the nursing homes for the residents and the staff. But we've still got a tough road ahead, and I think a lot of people have really stepped up to encourage the wearing of masks, the social distancing. But it's it hadn't been widespread, and I don't know that there's really pinpoint exactly where all the spread is occurring. I think a lot of it's in small groups. I personally am concerned about some of the churches. I know on Sunday mornings I've driven past some small churches that I've never been into. I don't know how big they are on the inside. They don't look very big on the outside, but have a parking lot full of cars. So I think that's one of the things that's concerned. I've been really impressed with our school districts in terms of really following the guidelines and being really on top of it. And so I think so far we've had a successful school year with all the challenges, but those challenges are going to continue because the kids, they're in the community. From my understanding, we haven't had it spread within the schools. It's all from outside the school or in the community that have bring it into the school districts. And one of the things that was a real kind of reemphasized the deadliness of this virus. At our meeting on Monday, two of the school districts mentioned that they had actually lost a member of their staff to the virus, and so that which kind of reemphasizes how deadly this virus is. As of last week, we had 155 deaths from the virus since the beginning of the pandemic, and I think we've had another 5 or 10 this week, and that's one of the things that we've also noticed, that in Garland County, our death rate is higher than statewide, and I think some of that is a reflection of our older population. But our death rate is about 155 per 100,000 of residents, and whereas statewide it's about 120, 125 deaths per 100,000. So it's a highly contagious, deadly virus that we're going to have to continue to deal with and move forward. And again, the vaccine's going to help, but it's not going to really affect things real soon. So that's just kind of an overview. I'm happy to answer any specific questions about the county or about the vaccine or the virus itself.
Dr. Shelby, we have a couple of questions on chat, and the first one is, when and where will the vaccine be available for seniors over the age of, it says 75, but I think 70 is now the age of that first tier of group of people?
Yeah, that's going to be in the phase 1B. We're still in phase 1A, which is healthcare workers, and even that's providing some challenges in that the initial vaccine went out to the hospitals, and so that the hospital employees in healthcare, I think, are pretty much vaccinated. They started when it first came out. Now the challenge is to get other healthcare workers vaccinated in the different clinics, dentist offices. It's kind of a more diffuse group of people, and so that's where we're looking at now. I think that they're hopeful, depending on the amount of vaccine that we get into the state, to begin the phase 1B around the 1st of February. And it's going to, and we're still working out a lot of the logistics on how that's going to be distributed. It's going to be distributed through some designated pharmacies, but we're looking at maybe being able to set up some kind of vaccination sites where people that qualify will be able to go to. But that's, at this point, that's really in the development stage.
That leads to a second question. I guess you can expand on a little bit, but for people that are in that 1B group, the people that are over the age of 70, is there anything they should do right now?
Really, there's not. One of the issues that came up at our meeting there was a pharmacist, Cody Turner at the Village Pharmacy, that is kind of the main coordinator for the pharmacies in Garland County, and he's kind of being overrun with people calling him, even though that people that are not in the 1A, they're in 1B or even 1C, asking that question, and so we're really trying to work on a way of getting more information out to the public about this. But at this point, I know there's some online things with the different pharmacies that you might be able to check on, but there's really not going to be vaccine available for 1B at least until February.
One more question, and these are all important questions, please ask. Do you know what the overall opinion is in our county as far as our residents, as far as the vaccine? I mean, how do you feel about that? Do you feel that the majority will get the vaccine, or do you think there's a divide there?
Well, I think so, but and that's kind of a concern that I've had all along, because there has been so much anti-vaccine sentiment, not just about this particular vaccine, over the last several years. And so there's a lot of people that are skeptical about vaccines. And I think some of the early polling showed that only 60% of people were even going to take the vaccine. And we even saw some early signs of that within, say, like the LifeNet ambulance service. There were some real concerns about from the employees there about getting the vaccine. But as time has gone on and more people have gotten the vaccine, and people see other people getting the vaccine because the side effects have been minimal, so I think there's a greater comfort level with the safety of the vaccine.
And then one last question. Well, two more here actually, but is there a specific hot spots that we see in the county, like maybe an area or maybe even a type of general community area that we have a problem with the virus? And is there a specific age group that we see the most cases in?
Well, I really don't think that there's any really specific hotspots now. I mean, we've had some mainly in the nursing homes before. We had one at Teen Challenge back early in the pandemic that was controlled, well. As far as any specific hotspots now, I don't know of any. One of the things that I do is I have access to a portion of the state's database in terms of Garland County, and so I can kind of monitor where in the county that we have more, and it's really pretty widespread. We've had some probably in Royal most recently. We've had a kind of had a little bit of a surge, and then in Jesseville, which hadn't really had much virus there, but has begun to have more. And then the Garland County portion of Hot Springs Village, for several months we had just less than 10 active cases there, and now we're up to 50 or up to even as high as 75 cases. So, but as far as any really specific hotspots at this time, I'm not aware of anything.
There's a couple more questions. I appreciate your time with this. Is the status of our nursing home residents and staff receiving the vaccine, are they about through with the process, you think, or is it still?
Oh, I don't know that they're through. I know that it started last week, and but I think the goal was to get the vaccines to the nursing homes mostly this week, though I'm sure that there may be some that'll extend into next week.
And then this will be the last question, I'll let you go. The question is basically, how's our hospitals doing? How's our ICU beds?
Well, that was, we have representatives at our meetings each week, and there's some real concerns about about the capacity that they had been maintaining, okay for the last few months, but over the last couple of weeks, they're seeing a lot more COVID patients and more ICU COVID patients, and I don't think they've maxed out, and I don't think they've gone to the surge programs that they have established. But there is definitely a growing concern about capacity issues.
Thank you so much. It's information that we greatly appreciate. And you've been a Rotarian for over 16 years, Dr. Shelby. You're a Paul Harris Fellow. We're just very proud of you, and we support you and all the work that you're doing. You're the sort of the point of the spear for us here locally, and we know that you put a lot of time and care and effort into what you're doing, and we really appreciate all you do for us, as well as all the other people involved with this. We will continue to follow your lead and follow your guidance every week that you provide to us, and we'll certainly do that as a Rotary group too, such as via.
Thank you very much.
Thank you so much for being with us, and we appreciate you very much. I want to remind everybody that we do have a board meeting next week on Tuesday at 11:45. If you want to attend, please let me know, or Donna Kay know. And just my closing remarks are brief, but it kind of dovetails off of what we've heard today. We've had a very successful 6 months of the first half of this Rotary year, and now we're in year 2021, and we're going into the second half of the year. And it still brings a lot of challenges to us, but the number one priority for this club, as far as me as president, as far as the officers in this club, and as far as the board of directors, is safety, 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 and the health of our members. That's the number one priority, always has been, always will be. And we will keep you up to date as things progress with the vaccine. And if we see a time and period when we think we might be able to meet again in person, but that'll be based on the Department of Health's recommendation and probably Dr. Shelby here in our group. The second priority is for our club, which we've done a good job at, although it's difficult, is service to those in need. And we've done that, and I'm proud of us for doing that. Thirdly, and this is very important, is member value. Do you value being a member of our club? The board, the officers, and myself, we have to make sure that we maintain that. Without member value, our club will diminish. So the value of your membership, do you value the club? That's the third priority. Fourth is our club's financial health. Are we in good financial health? We keep a close eye on that. We talk about it greatly each board meeting, and we will keep you informed on that. So that's the four things: safety, service to those in need, member value, and club financial health. And that's what we'll continue to focus on for the next 6 months. Thank you so much for being here today. Again, thank you, Dr. Shelby, for being here with us. And thank you for spending time with people who greatly care about all of you. And we are adjourned. See you next week.